Thank you so much for having me. Let me advance my slide here for a second. Okay, so everyone's familiar with Renown? Just want to make sure. Does everyone know that we're a nonprofit? Okay, we're a not-for-profit. And so one of the biggest areas of interest in our community is people don't really know that we are actually a not-for-profit healthcare system. And a little bit about myself before, so you get to know me a little bit. I'm a Nevada native, and was born and raised here in Reno, and in 1974. And I'm dating myself a little bit. And I went to Reed High, and then I left the area for about 8 to 10 years to go play softball. I went to Arizona State University and played my softball career there. And yeah, then I got my bachelor's and master's from Arizona State University, and then I got my doctorate in 2016 at the University of Nevada in so the doctorate in education. So a little bit of my background, and then my whole career has been in intercollegiate athletics. So my whole life has been competitive and really trying to provide opportunities for student athletes to continue their education. And then I was the first athletics director at Truckee Meadows Community College, and I ran that program for 3.5 years and built that. And then I really wanted to serve this community, which means the world to me. And I love this community, and I know you're a part of this community. And the work we do at the foundation really is community-facing, coming to events like this, meeting with individuals like you to really talk about what we have to offer at Renown. And so I've been a major gifts officer in the foundation for 3 years, and I'm going in my 4th year. It is one of my most favorite jobs. And I know my whole life has been competitive, and I've been competing, and I've been an athlete my whole life, but I think this position is the most rewarding for me, and I can see myself being in fundraising, especially for our healthcare system, knowing the impact that we have on you and having an impact on this community and bringing better care for you in this community. So my role at Renown is a major gifts officer, and what is that is, let me start with the foundation first. What we do is we have a team of individuals who work with our community and large foundations that are either national, local, regional, whatever foundations that we can get right grants for. We work with also private donors in the community who have a philanthropic interest for healthcare, and or grateful patients, people who have been impacted by our health system, a doctor, a nurse, their life was saved, their grandchild was saved, they have whatever the case is, and they feel an interest in giving back to what we're doing because we are a not-for-profit, and we can raise funds to advance care. And some people say, well, I don't want to give money to fill a budget deficit. Your money will never go into a budget deficit. That is not what philanthropic dollars are for. The reason why we do raise money is to advance care and bring the best and brightest equipment, doctors, what have you, to the region to be able to provide you those specialties. Some of you probably who have been in the area for many, many, many years know that when you had a special issue, or you had some type of cancer, or you had a special, like something that was acute, more acute, oftentimes you had to go to California, or you had to go somewhere else because there are better doctors there, or more sophisticated, more, better doctors, I should say. Anyhow, now you can stay, there's a lot of specialists that are now at Renown to where you can stay here, whether it's in heart care, cardiovascular care, heart vascular, or if it's in cancer. We have just hired a whole team of urologists, not neurologists, those two, but urology, and that's another really big specialty that's much needed here. We are a tertiary care facility, which means there's a lot of specialties that we do, special acute specialists that we have. We are not a quaternary care facility. That is where we will outsource or out-migrate care to, say, University of Utah, or we will out-migrate care to California if it's like a burn. We don't do burns. We also don't do heart transplants. We don't do pediatric heart transplants. That's where you have a big Cleveland clinic. You would have like UCSF. Those are quaternary care. We are tertiary, which is level 2 trauma. We're the only level 2 trauma center or trauma center between Salt Lake and Sacramento. We serve 100,000 square mile catchment area. We serve 1 million people, and it's 17 counties. And that includes some Northern California, all the way down to Tonopah. So we have a really big catchment area. And then being in the not-for-profit and being a level 2 trauma and the most acute, we can handle the most acute center, is we give away $150 million annually in uncompensated care to this community. So when individuals come into Renown and they can't pay, or we're still taking them, or we're going to make sure that they receive the highest level of care. We can't send them to Northern Nevada, we can't send them to St. Mary, they will stay with us, and we'll make sure that they are taken care of. So anyway, I work in the foundation, and what we do is we raise money for the hospital to advance care. I'm a major gifts officer, and so what that means is, my goal is to try to bring in 25,000 and above, up into the millions. But you can't get there until you build trust and build relationships with individuals in this community and let them know that we are there for them, and ultimate goal is your health. It's because we don't have a vibrant and fun and great community to live in if we don't have good health care and you're not healthy. So there's that piece. Navigating a large health system, it's daunting. And we are a health system. We have 7,000 employees. You know, we have the South Meadows facility, we have Renown Maine, we have all of the Renown Medical Group, which is those facilities you see that are either urgent care or your general GP is there. So we have a lot. And so sometimes it can be a little bit like, okay, I don't even know who to even call. So I have a card over here. And it doesn't matter who you are or whatever, please call me. I can help navigate this health system, because that's what I love doing, is making sure I can plug a hole, or here's a phone call, oh my gosh, we just got a new doctor, let me introduce this person to you, because I think it's helpful. And I think, and I love to serve our community, and that's my biggest, I love it, I love serving, so I wanna help you. So take my card, call me anytime, or email me, whatever, and I'll get back to you and just remind me you're here at this event. And then I can try to help get you in front of somebody, or I can try to get you an appointment. I can help get you with Hometown Health if you're thinking about going to Senior Care Plus, or you want to be in the Sterling Silver program, or what have you. I can get you in the right direction. Oftentimes you either call 982-5000 or 982-4000. You're like, this is a phone tree. This is not a human. You can call and talk to me. I'm a human, and I will. And I'll take your phone call. And no, I will, I promise. And I just think it's important because it's stressful. And when there's something that happens with your healthcare and you are stressed and it's anxiety, or I have an issue or what have you, I want to help allay those fears if I can. Now, I'm not a physician, but I can at least help get you in the right direction. So please know that. So I think it's important for us to serve our community. That's why it's important for me. And also the people on our team is, you make us better, and we are trying to, and again, I will be full disclosure, we are not perfect. We will never be perfect, but we are striving we try to do our best every single day to be the best healthcare system we can in the state of Nevada. So we're here for you. We already talked about not-for-profit, quaternary care, we talked about that. Renown Medical Group is when we say Renown Medical Group, those are physicians that work for us, and they are also the ones that are in outlying areas. So that's that. And then South Meadows, are you guys all aware of our expansion down at South Meadows? Anybody, have you seen the big building? Oh my gosh, you guys, we're getting 6 new operating rooms. We have a cath lab down there now, so if there's a STEMI, which is a heart attack, if this happens on the south end of town, it can be brought into South Meadows. So we're now able to service that into town. On the 3rd floor of the specialty care center, the big building you're seeing that's brand new, that is the Conrad Breast Center, and it's a but comprehensive breast care center. And that is anything from infusion to radiology to wellness to senior doctor to all, it's a one-stop. And so it was a big deal to us to be able to serve this community. The incidences of, with the growth that we have, the incidences of breast cancer is going up. It's not going down, and so that was a really big deal for us to have that put there. So if you want a tour, I know we're gonna go live with that in May, but if you want to tour that, please reach out to me and I'll let you know when those are occurring, because I think you'll love it. It's a great space and it's the addition down there is beautiful, it's state of the art, and so it's welcoming, and we have a food cafe down there now that's actually functioning, so that's great. Tours, I'm always wanting to give tours. I love telling our story. If you want to go to the NICU, PICU, that's a beautiful space. We're on the 5th floor there, and then wherever you want to go, if you want to learn more about urology or neurology, I can hook you up with a doctor or hook you up with somebody who wants to talk about that. Just let me know. But I love giving tours and showing our space off. Sterling Silver is who's aware of Sterling Silver Group? Perfect. Okay. Yeah, it's a program. It's free. There are a lot of programming, different things that you can do. I know sometimes there's some transition with leadership in there, but anyway, call me. I'll work on that with you. But there's change in leadership, and so. But anyway, with Senior Care Plus, you're all aware about Senior Care Plus. If you need help with getting an appointment, I have a gentleman I work with. He lives in Tin Valley. He's 88 years old, and I was able to hook him up with his daughter and get some questions answered with a person who actually was a human at over a desk talking about things, because that's what you like, right? His computers can be a little bit stressful and stuff, and so it was great just to have a face-to-face meeting. And then the last item I have, and we have some literature on it over here, but I can also have a conversation with you, and we have an incredible staff member. Her name is Abby Stevenson. I don't know if any of you know her. She was a practicing attorney, went to law school at UC San Diego, and she practiced in the area for a while, and then she wanted to be with her kids and have more time, so she's part-time with us, but she put together our Plan Giving, our legacy program, and that is, do you guys know what legacy planning is, or estate planning and all that? Well, in there, sometimes people feel when they're done, they don't want their estate to go to the government. Oh God, I do not want my money to be stuck with the government. I want it to go to all the charities, and here's the charities, and so they put it in their estate and stuff like that. And so people are very philanthropic, and they want to make a difference at Renown, and they'll put us as a beneficiary. And there's a whole bunch of ways that you can get, not just, what is it, a remainder trust or revocable trust or all of that stuff. She is the guru of that, and she started a whole program, and we love that people are thinking of us when they're gone and that they want to make an impact. So that's what a legacy plan giving program is, and it's making a big difference for us at the end. So that's it. That's all I got.